My name is Dr. Bojana Jankovic, and I'm here with Dr. Teresa Dean. We're going to be talking about some truths and myths about diet. And these came from some of the most commonly asked questions that we get asked in our primary care practices. So number one, can I get all the nutrients I need from a vegan diet?
No, you cannot, actually, but we can solve that with supplementation. The biggest issue really comes down to B12. It's one of the only nutrients we can't extract out of a vegan diet purely, but we can supplement that. So really it comes down to testing patients. So you really want to know what level of deficiency people have. There are some people who don't get B12 deficient, but for the most part, most of the studies range for up to 90% of vegan patients developing a B12 deficiency. So we do need to supplement that part.
Absolutely. And vitamin B12 deficiency is very important to monitor and detect because vitamin B deficiency can result in nerve damage, neuropathy, and cognitive problems as well. And now, Dr. Dean, can you get enough iron from a vegan diet?
You actually can get enough iron in a vegan diet. It just takes a little bit more work. The issue really becomes women of childbearing age really need up to 18 milligrams of iron a day, which is quite a bit. But there are dietary sources in a vegan diet, including raisins, green leafy vegetables, molasses, and then, of course, enriched foods. So if you're looking at iron-enriched foods from grains, they can also get that in their diet.
Another one that I get so many questions about, gluten-free diet. Who benefits from it? Why? Do you have to have celiac disease to be on a gluten-free diet? I mean, what is all this stuff about gluten?
Yes, gluten-free is the fad diet of the generation, but it really comes down to a lot of people feel like if I benefit from a gluten-free diet, I must have celiac disease, and that's absolutely not the case. There's really less than 1% prevalence of celiac disease in the US population, but a lot of people feel the benefits of a gluten-free diet just by limiting their processed carbohydrate. So the important part is not replacing all of your processed flour and wheat flour with rice flour, because a lot of times then we develop nutrient deficiencies, but replacing that processed wheat flour with more whole foods, vegetables, fruits, meats, those kind of things that are still going to be very nutrient rich from us, and removing that processed carbohydrate.
And then lastly, another question that I get a lot is about low fat versus low carb diets.
I'm going to quiz you on this one. So is the best way to lose fat a low-fat diet?
No, it's not, actually. So the best way to lose fat and to lose total body weight is actually to be on a low-carb diet. So a New England Journal of Medicine study showed that people who were on a low-carb diet lost actually 7.3% of total body fat compared to people who were on a low-fat diet and lost just a little over half of that, 4.5%. They also showed that a low-carb diet actually reduces triglycerides and increases HDL, which is the good cholesterol. Another diet that's actually been getting a lot of attention that we always actually recommend to people who either have or are at risk for cardiovascular disease is Mediterranean diet, where people use extra virgin olive oil. They avoid red meat. They eat fish. They eat plenty of fruits and vegetables, whole grains, nuts. This diet has many benefits for cardiovascular health. Thank you so much for watching. Please feel free to write any comments, questions, or anything else that you'd like to see. Thank you so much.
Thank you.